As the process gets going, one of the most important things that we like to do here at the surgery center and in every operating room setting is to verify the correct site of surgery. So for every single patient that I will operate on, I will come up and I will say, good morning, hi, how are you?
Super.
Good to see you. If you could just describe for us today what surgery we're going to be doing for you?
A knee arthroscopy.
Outstanding. So now what I will typically do is come right over with a permanent marker, which will eventually go away in about 10 days or so. Come directly up to the patient, and I will sign my initials, and I will put the word yes. And this really guarantees that once we get into the operating room that we're going to be verifying the correct side. Inside the operating room, we also do something called a timeout, which where everybody stops what they're doing, and we do site verification within the operating room again to ensure that we're always doing the correct side.
Go.
Okay, great. So here we are. This is a section of the operating room area is called the holding room, and this is where I will come over and actually interview patients prior to surgery, specifically answering any questions that they may have, but also making sure that we are operating on the correct side. So now what I would typically do is ask the patient if you could please tell us what the procedure is that we're doing today and which side we're scheduled to operate on.
We're going to do a right knee arthroscopy.
Fantastic. So now what I'll do in order to verify one more step that we're doing the correct side is I will actually sign my initials and put the word yes. That will actually guarantee that we are doing the correct side. Once we're in the operating room, we'll perform another procedure which is called a timeout, where everyone will stop doing what they're doing. We'll verify with the surgical consent, looking at the marking pen, that we are doing the correct side, and that way we virtually can eliminate wrong site surgery.
Okay.
And so by doing the timeout, we can basically eliminate wrong site surgery. My name is Dr. Scott Sigman. I'm here at the Chelmsford Drumhill Surgery Center, which is owned by, actually skip that. Scott.
Let's start one rep 3, 2, 1.
Sigman. We're here in Chelmsford at the Drumhill Surgery Center, which is owned by Lowell General Hospital. And we thought it would be a nice experience to show everyone what it would be like to have a knee arthroscopy, and we're going to basically go through some of the steps and show you the various processes and sort of try to educate everyone as to knee arthroscopy. Let's do that again. Hi everyone, I'm Dr. Scott Sigman. We're here in Chelmsford at the Drumhill Surgery Center, which is owned by Lowell General Hospital. I'm an orthopedic surgeon that specializes in knee arthroscopy. And what we thought we'd do today is give everyone the experience of what it would be like to have a knee arthroscopy. And we figured we'd start by bringing you into the operating room to be able to see the equipment and get a feel for what it looks like.
Right now.
Okay, fantastic. Well, welcome to the operating room, everyone. Here we are inside. I want to give everybody a feel for what the actual operating room looks like. This is the operating room table where you'll be able to rest and put your head down and go to sleep. So I'll be able to do my thing. Over here, we have what is called the arthroscopy tower. This is a high-definition television set, and with this I'm actually able to put a camera inside the knee and then be able to view everything directly up onto the screen over here. It's really terrific, state-of-the-art technology. We're able to take picture images as well as video of the knee as for the surgery as well. This is the setup over here for where the fluid is going to be pumped into the knee. As a general rule, what we like to do is have a fluid medium so we're able to see very clearly into the joint, and that way not create a lot of injury to the cartilage on the inside of the knee. And then over here is just the basic instrumentation that we utilize over in here. And once the patient's brought in, we're going to give you a little live action shot of what it looks like, visualizing everything as we're doing it live.
Action.
Okay, so welcome everyone. Now we're actually in the operating room suite, and this is where we're going to be taking care of you when it comes time for your knee arthroscopy. Here's just the standard operating room table. This is where you're going to be lying comfortably so that we'll be able to do what we need to do. Over here is what we call our arthroscopy tower. This is a beautiful piece of equipment. It's actually a high-definition television set, which allows us to look with state-of-the-art techniques inside your knee and be able to view it directly up onto this screen right over here. In addition, we're able to take imaging studies such as pictures and video of what's happening inside the surgery as well. Over here to my right, this is the standard fluid management system, where what we're doing is we're pumping fluid into your knee joint so that we're not creating injury, and I'm able to visualize exactly what we need to do. And then finally over here, this is the standard operating room back table. This is where all of the instruments are, which are all sterilely prepped so that we're making sure that we're doing good work for you on the inside of your knee.
Okay, you're live.
All right, fantastic. So welcome to the actual operating room, everyone. And at this point right now, what I've done is I've made 2 small incisions, and I've actually put a very small camera inside the knee joint, which basically is attached to this device right over here. It allows me, with this line, to go directly into this high-definition flat screen up here, and we can actually visualize directly what's happening on the inside of the knee joint. And it's really amazing the technology that we have at this point to be able to see and do all the things that we want to do. Now, knee arthroscopy is really quite interesting compared to a lot of other surgeries. It's very much almost like a video game in certain respects, because classic old-time surgery was an incision in front of you, you used your hands, everything you saw directly in front of you. But now with these newer, minimally invasive techniques, I'm actually tapping a device over here with my foot to control a very special shaver, which is this device here, which I use to help remove the tissue that's torn. In addition, I then hold my hand over in here, and you can see that I'm actually visualizing everything up on the screen. So I'm not even looking at the area where the surgery is taking place down here. Everything is happening up on the screen. So it really is very much sort of video game technology, allowing us to have an understanding of what the knee looks like in space. The other thing that I would point out is that the incisions that I'm using here are only 1 centimeter. The very small incisions, we actually close those incisions with a special suture that is bioabsorbable, so no sutures need to be removed. We describe this really as a Band-Aid surgery. Patients can come in and basically be showering and bathing the day after surgery. So it's really quite remarkable how quickly you can get up and moving for this type of situation. Okay, that was pretty much what I would want to say. Is the audio on?
You are live.
Okay, so typically what we'll do at the end of the surgery is we'll put a nice big sterile dressing over top with a big ACE wrap such as this. We're going to give you a big ice pack to go home with as well. You're going to be on crutches for 1 day. Then after that, you can get rid of your crutches altogether. Tomorrow we instruct the patients to get rid of all of this bandage here, put a Band-Aid over each of the incisions, and they can actually take a shower and bathe the day after surgery. So that's the experience of the knee arthroscopy, and hopefully we won't have to see you here in the operating room one day for yourself.
Perfect.